Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to be discussing a medication known as Sotalol. Its brand name is Sotacor. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. In this video, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe Sotalol to a patient, followed by contraindications or reasons we would not be able to prescribe this medication. We'll then touch on examples of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So sotalol hydrochloride is an antiarrhythmic agent with beta-adrenoreceptor blocking properties. Class 3 antiarrhythmic effects are seen at higher doses than those needed to achieve beta blockade. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of an atrial arrhythmia, as well as in the treatment of life-threatening ventricular arrhythmia. With respect to contraindications or reasons we would not be able to prescribe Sotalol, well, we wouldn't give this medication to a patient who had bronchial asthma or related bronchospastic conditions, patients with cardiogenic shock, uncontrolled or decompensated heart failure would not be able to use this medication, as well as patients that have congenital or acquired long QT syndrome. If a patient had a creatinine clearance less than 40 mL per min, when this medication is being used in the treatment of atrial fibrillation or flutter, that would be a contraindication, as well as patients who have serum potassium less than 4 milliequivalents per liter, or sinus bradycardia, which is a slow heart rate, of less than 50 beats per minute. Now for some examples of dosing with Sotalol. So in the treatment of atrial arrhythmia, the oral dose initially would be 80 milligrams orally twice daily, with the option to increase in increments of 80 milligrams per day every 3 days. Good clinical response is often seen with 120 milligrams twice daily. In the treatment of ventricular arrhythmia, again orally, the medication would be started with 80 milligrams orally twice daily, may increase the dose again in increments of 80 milligrams per day every 3 days, and the usual dose here, after everything is settled, would be 160 to 320 milligrams per day, divided in 2 or 3 doses. Doses up to 640 milligrams per day have been used in certain situations. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Sotalol, so we'll go over some of those here now. 13 to 20% of patients may experience dizziness, while around 20% may experience fatigue. Chest pain may happen about 16% of the time, and a rash may happen 5% of the time. Dyspnea, or difficulty breathing, may happen between 9% and 21% of the time. 3 to 11% of patients may experience a headache. Now, some more serious side effects would be heart failure, which may happen about 5% of the time, atrioventricular block, prolonged QT interval, or congestive heart failure, which is 1 to 3% of the time. Alright everybody, that's all we're going to talk about today with Sotalol or Sotacor. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.